President Obama making a big push for his health care overhaul just moments ago. Mr. Obama giving a Rose Garden speech highlighting the struggles ordinary Americans face every day when it comes to health care. Joining the president, 150 doctors, some from each state in the country, who support a government-run insurance option, I should say. One of those doctors who met with the president this morning joins us now, Dr. Michael Newman. He is a professor at the George Washington University Medical Center, and it's my understanding, Dr. Newman, you also have a private practice, right?
Correct.
All right, so you are a supporter outright of the public health option that the president wants to put forward?
I'm a supporter outright of the administration's position that we need health care reform. It's not to be distracted by the issue of the public option, which I support. The important point is to get Americans insured, make care available, accessible, and affordable. And over 35 years I've been in practice, that's been continuously eroded.
In your view, what's done the erosion?
Insurance companies have done the erosion, no question about it, as well in many respects. First of all, the rising cost of health care makes it increasingly unaffordable and unavailable. Secondly, the intrusiveness of insurance companies second-guessing what physicians, the care that physicians are providing. Thirdly, the time that we spend in bureaucratic haggling with insurance companies. So it's come down, this issue of health care reform has come down to hand-to-hand combat. And I represent part of a surge of physicians, and we're going to see that this is going to happen. And the administration's done a phenomenal job, led by the president, to bring to Americans an understanding of what the health care issues are. Availability, affordability, accessibility, and appropriate care. I want to care for patients.
What about Medicare? Do you treat Medicare patients?
Yes, I do treat Medicare patients.
And how does that system work for you?
It works a lot better than the private insurance companies. Medicare does not have a panel of physicians that patients are restricted to. Medicare does not require pre-authorization. Medicare is actually less bureaucracy, less telephone calls than any of the private insurance companies.
But if you had to build if you had to build your entire practice on treating Medicare patients, would you be able to survive financially?
I don't think anybody's proposing building the entire health care reform on Medicare. I think it should be, Medicare should continue. As the president has said, if people are happy with the insurance that they have, they ought to be able to continue it.
But you don't think
I understand it.
You don't think that's a realistic possibility? I mean, if there's a government option out there, aren't a lot of small businesses just going to shove their employees into a government option?
You know, I'm involved in care. All I can tell you is that patients need to be insured so that they can have adequate health care. I'm also not just a physician. I'm a small businessman.
Sure.
I have a staff. We provide health insurance for our staff. They have a range of options to choose from. It is increasingly expensive, and in fact, compared to other rising costs of managing a practice, our health care premiums, as for every other small business individual, are the most significant issue that we're confronted with. And I wonder where those premium dollars are going. It seems to me they're going to salaries and profits of private insurance companies. And that doesn't occur in Medicare, where the administrative costs run 3%.
All right, Dr. Michael Newman, good to talk to you. Thanks.
Thank you.
Well, the war in Afghanistan is